All right, everybody, welcome to our red wine conversation on this Tuesday evening. I'm Othor Cain. Glad to have you here. We've got lots to talk about today. We're continuing our series and our coverage on COVID-19. I am excited to have with us today Dr. Justin Turner. And we're going to give you an opportunity, though, to get in the room, to get situated, to grab your wine, to grab your drink. And let's have a real conversation. There's so many misnomers. There's so much misinformation out there. And social media doesn't help in some of the cases, right? In a lot of the cases, because I think with the advent of social media, everybody is an expert now, right? And everybody has all the answers. But we're going to try to cut through a lot of the noise and get to the heart of what's happening in Jackson and Hinds County and across this state, right? So I'm excited to have Dr. Justin Turner, who is on the front lines. And this brother, he is seemingly working around the clock. Dr. Turner, good evening to you, sir.
Good evening. Thank you so much for having me.
Well, I am glad that your schedule could avail, or that you could avail your schedule to be with us. Before we get into COVID-19, and not that you need this major long introduction, but just give folk just a little bit of your background, and then we'll jump into the conversation.
Okay, so good evening once again. Thank you so much, Othor Cain, for allowing us to have this platform to be able to speak and talk about the issues. My name is Justin Turner, and I am an internal medicine physician here in Jackson, South Jackson, to be exact. I happen to own my own practice called Turner Care. We've been in existence since November of 2013. I'm from Mississippi, born and raised here, proud Mississippian. Went to Jackson State, I love for undergrad.
You're from Vicksburg, right?
Yeah, I'm sorry. So I left that part out. So I did go to high school in Vicksburg.
Okay.
Graduated from Warren Central back in 99. So left there, went to Jackson State, and was there from 99 to 03. Then I matriculated into medical school in Nashville at Meharry Medical College, the first and oldest HBCU for medical school.
Right.
For black medical school. And left there and came back to University of Mississippi Medical Center, where I did my residency in internal medicine. And that was from 2008 to 2011. I took a job with a local hospital corporation and realized really soon that in order for me to carry out the mission that I feel God called me to, that I was going to have my own practice. So I stepped out on faith and I did that. And I started my own in November 2013. And I know we got to talk about that as far as hospital administration and what it has to do with this COVID-19. And, you know, like I said, I've been in existence since 2013. That's been a blessing ever since, to be able to take care of the greatest people in this state that we call home.
That's awesome, man. That's awesome. So you are more than qualified to lead this conversation this evening. And again, we are grateful. And listen, and here's where I want to start. I want to get some basic understanding, because there are a lot of misnomers, a lot of misinformation out there. And I guess my first question, Doc, is, what makes the coronavirus so different? You know, we are aware of Ebola, we're aware of SARS, we're aware of Zika. What makes COVID-19 so different?
Okay, so that's a great question. What makes COVID-19 so different is the fact that we have never seen it before. It is a totally new strain. Matter of fact, COVID-19 comes from the parent family called coronaviruses. So if you look at the back of a Lysol bottle, you'll see the word coronavirus. So coronavirus is not new. However, this particular strain is new.
Okay.
And this particular, strain is zoonotic, meaning that you can get it from a human and you can get it from an animal. And this is thought to have come from Wuhan, China, and we got it from a particular animal that has jumped into a human, and now it's spreading from human to human. So we had SARS-1, which was in 2002. We had a big outbreak. That was a type of coronavirus. We had a common cold, which is actually coronavirus that everyone listening to this particular feed has probably had at one particular point in time. Now, if there's a family of five, and there's a husband, there's a wife, there's a few kids, and someone gets a common cold, notice that everyone else doesn't always get sick. Or if they do get sick, they don't get sick at the same time. Or we can take something like the flu. Somebody in the family could have the flu, and everybody don't get the flu at the same time. So why is that? The difference is we have built up immunity, which is basically the process of producing these antibodies and different things that recognize something the body has seen before. And when the body has developed an immunity against something, you are more likely to be protected if you face it again. Well, Mr. Cain, since COVID-19 is totally new, nobody in the body has ever been exposed to it before.
Right.
So that's one thing, the fact that this is totally new. Secondly, according to some experts from Louisiana, this thing is 1,000 times more contagious compared to the flu. 1,000 times more contagious. So this whole thing of social distancing and making sure we're staying home is that serious, because the third distinguishing factor is the reproductive number. And this has to do with how infectious this thing is. You have about 14 days that you could be walking around with this and don't show any symptoms at all. If you compare it to the flu, you normally have an incubation period of about 3 days. So if you're around other family members and you have the flu, if someone else is going to get it from you, they would develop symptoms within 3 days. But with coronavirus, you could be around somebody and you may not show symptoms for a whole another 14 days. So you could be going to Kroger in the grocery store right now.
Right.
And you could be going back home and you could drop something off to Medea, and you can come back the next day, you can go to work, and day 12, you get symptoms. And now it's like, man, the whole last 12 days, you've been spreading around.
Wow.
So those are three quick things that kind of distinguish COVID-19 from any other type of bacteria virus that we've ever seen before.
Gotcha. And since you mentioned that, the symptoms, let's talk a little bit about the symptoms, because people are worried about how do you catch it. So let's describe some of the symptoms. And here's what I have learned, that, you know, the same symptoms, they don't necessarily show up the same way in everybody.
Right. So let's talk about the symptoms. So the first thing I want to talk about is the more common symptoms, because, you know, Mr. Cain, we're learning new information about this thing every day, and we really need the public to be patient with us, because it may be kind of hard to trust when you're hearing information that's changing what may seem like month to month or week to week. So at first, we was initially thinking this was something that primarily affects the respiratory system, and you have fever, you have chills, you have cough, you have shortness of breath. Well, although those are common symptoms, I'm finding patients who have atypical symptoms, meaning that these are less likely, but patients coming in with abdominal pain, patients having diarrhea. I even had a patient last week who just had loss of smell. So it's one of the things where if you're listening, if you have any symptom that's different compared to your norm, you need to be calling your doctor, because you don't want to just assume that, oh, I'm just tired, and just go to sleep, because you go to sleep, you may not just wake up the next day.
Wow. So in terms of catching it, Dr. Turner, you know, how is it transmitted?
How is it transmitted? So it's transmitted pretty much airborne, through the air, and also droplet. So coughing, sneezing, anything that you expel out of your mouth is a way that it can be spread. So we talk about this thing of social distancing, trying to stay 6 feet away. So yeah, you can cough, you can sneeze, and you can spread it like that. But believe it or not, you can actually spread it by just talking. Mm-hmm. So there's things that are microscopic, meaning that we can't see it with our naked eye. But in actual casual conversation, you can be talking and you can be spreading this. So it can be spread through the air. I mean, we're finding out more information about how long this thing possibly is lasting in the air.
And that was going to be a question, because I've heard different stories about, you know, the length. Like if I get on an elevator, or if somebody just gets off of the elevator and I get on, how long does it linger there?
Yeah, so one thing they're looking at is how long does it stay on hard surfaces, how long does it stay on plastic. So you got some information that came out in the New England Journal of Medicine that talked about the virus staying on plastic for 72 hours, staying on stainless steel for like 48 hours, staying on cardboard for 24 hours on copper for 4 hours, and some people thinking that it's staying in the air for about 3 hours. So at this point, I don't think there's enough conclusive data to be able to know.
Okay.
But the recommendation is still the same, and that's making sure that whatever you touch, you're making sure that it's being sanitized, it's being wiped down, proper hand hygiene, which we should be doing anyway, right?
Right.
But even a more aggressive precaution, such as when you go home from going to the grocery store, take off all your outer layers of clothing.
Okay.
Leave them at the door. Actually, take your shoes off. Spray them down with aerosol, especially spray the bottom down, and wash all your clothes. Go ahead and take a shower, because we don't know what you've been exposed to. You just don't know.
And there's no conclusive data in terms of how long it lingers in those objects or on those materials.
Right. Exactly. There's some doctors who are married to each other. They're not even staying in the same house right now.
Wow. So we've heard droplets. We've heard aerosol. Can you talk about aerosol? Break that down for us.
Yeah, so let me break that down by, I guess, trying to juxtapose the two. So when we talk about droplet, we're talking about me coughing, and let's say I cough and some of the droplets gets on my hand, and I take my hand and I touch the doorknob.
Okay.
So that's kind of spreading through droplet where it's touching the surfaces or something. Whereas aerosol, you think about, just say a Lysol bottle, and you spray it in the air. So the aerosol has to do with particles dispersing in the form of air or gas. And it just happens to be in the atmosphere, just up and about. Whereas droplet is on the ATM card. You went to Popeyes and you had a 2-piece chicken, and you gave the waitress your card, and the waitress or the person, the cashier, has gloves on, but she has the same gloves on from the previous 3 or 4 cars. So the person in front of you happened to have COVID-19, and they gave their card to the cashier. The cashier picked up the card. She didn't change her gloves. She gave it back to you. They're spreading it through droplet.
Right. Gotcha. People are afraid. People are scared because of the unknown, and it seems as if information is changing every single day. I want to talk specifically now about African Americans, our community.
Yes.
When this thing first surfaced, again, sometimes social media can be our worst enemy because it makes everybody an expert, right? And so there were people saying that African Americans couldn't get it, that we were prone to it.
Yeah.
And now we're understanding that it is affecting us in a disproportionate kind of way. Can you talk about why that is?
Wow. Okay. So I've actually been blocked because I took the bait and went back and forth with someone on Facebook about it. And one of the things I talk about, Mr. Cain, is taking a strategic break from social media, because there's so much misinformation on there that someone like me, who's on the front line, who feels a responsibility to make sure that...
And you are literally on the front line, literally.
Yeah. It's personal. There's been over 50 doctors, I think in Italy, who died. There's 3 doctors who died within the last week. So to scroll down the timeline and hear people saying Black people can't get this, and this is 5G and it's not a real thing, man, not only is it egregious, it's irresponsible.
Right.
You basically, what do you call it? You're an accessory to murder.
Wow.
If someone reads your post and they're Black and they think that they can get this because of whatever the reason is, they get shortness of breath, and instead of them calling their doctor, they just take some hot saline and take some over-the-counter stuff and think that they're going to get better, and 3 days later they end up dying. Literally, I think you should be charged with accessory to murder. Wow. Because they took the information that you shared, and instead of calling their doctor, they just trusted their Facebook expert, because we've allowed ourselves to be these self-promoted experts, and it was just totally irresponsible. So all that being said, Black people can't get this, and we see now that they are getting it. Matter of fact, the data is showing that we are disproportionately being affected. Matter of fact, Louisiana and Chicago are both areas where there's a very, very high minority population. Studies are showing that 70% of people who have died with the COVID-19 are blacks.
Wow.
70%. And see, when you look at Mississippi, what are we, about 33, 35% of the population?
Yeah, I think we're about 37. Yeah, we're right at about 37.
Yeah.
Mm-hmm.
You're somewhere around that. But it won't be a surprise if there's more conclusive data that's showing the same thing in Mississippi. Now, there's several different factors that can weigh into that, and if you don't mind, I'll try to explain some of those.
Please, because I was going to ask you about some of the underlying conditions that push us into that bracket.
Okay, so anybody that's listening have probably heard that blacks are more likely to get diabetes, or blacks are more likely to get heart disease, or it appears that blacks are more likely to get cancer. And there's a lot of research out there that shows that blacks are more likely to get a lot of conditions compared to others. So with that being said, we already are in a disadvantaged position because we have more medical conditions per capita compared to other populations. And if this COVID-19 is something that's more likely than somebody who has a weakened immune system, if we have more conditions per percentage of people, we're more likely to have higher numbers. That's one.
Okay.
Because we have more pre-existing conditions, to include just hypertension,
right,
to include obesity. So we're leading the nation in obesity, and we've done so for the last 9 years. 1 out of 3. 1 out of 3. So if you look at obesity and hypertension and compare Mississippi to other states, get this. If you compare Mississippi to other states, what you will find in the data is we're having more younger people that's being affected. Why? Because we have younger people that are less healthy compared to maybe your New York or your LA, where when I travel there, I don't see as many people, riding cars. They're walking, they're jogging. There's bike trails. So speaking of bike trails, the second thing is actually access. We don't always have the same amount of access to adequate health care compared to other populations as well. So right now, we don't need a lot of people in the grocery store because that's going to be the next vector. That's where a lot of people are hanging out. But if you can't afford to stock up for 2 weeks and you can only buy enough for 2 days, then what are you going to do?
Right.
You got to go every 2 days.
Right.
So access to having the adequate resources to be able to, have health care, to be able to have insurance, to be able to get healthy foods. Like right now, we know that 70% of your immune system is in your digestive system. Mm-hmm. 70% of your immunity is in your gut. So it's not just what you eat, but how you eat, when you eat, and all that type of stuff. So if you're able to eat better, you're able to have a better immune system because you can afford to get the chicken and the fish versus the pork and stuff that's on sale that's cheaper than anything else.
Absolutely.
What do we buy?
Absolutely.
We buy what we can afford.
Absolutely.
Right?
Absolutely.
So access is a big factor as well. It's several other factors, but we definitely have to knock down these myths because it's making people make a lot of misinformed decisions and it's killing us literally.
Doc, I got to ask you, I mean, and it really is killing us because we don't have access. We don't have access to proper health care. And you cleared up a point of contention for my friend Marilyn. She wanted me to ask you about obesity,
okay,
if obesity was a driving factor in blacks. And so you did that. I want to talk specifically now about tests. And if you think that there are enough kits or tests in Mississippi, if you think that there are enough, and then once you talk about that, let's talk about ventilators. Because at one point, we heard that we had an abundance of ventilators in Mississippi, and then UMMC just said today, they need them. You know what I mean? So talk about tests, the availability of tests, and then ventilators for us.
All right, you definitely picked some hot buttons.
It's what I do, man. It's what I do.
Look, and anybody listening, and I tell you, I really, hate to digress, but I appreciate you so much. I really appreciate you having this platform because the people just want to feel like they can talk to somebody that they can trust.
Absolutely.
And they can get real information from. It's one thing to hear the experts on TV that's nationwide that we don't know. That's
right.
not someone that we can physically touch, but to have faces like the witness you had yesterday that can be honest and talk about this process, like it makes things more relatable.
Yes.
Okay?
Yes.
All right. So back to your actual question. So let's talk about tests first. So the easy answer to your question: are there enough tests? That's the big question. Like, why can't I be tested?
Right.
Someone posted on your comment already basically saying that if you don't have fever, they're going to send you home. So to answer your question, no. Mississippi does not have enough tests right now.
Okay.
Okay? And there's several reasons that likely can explain that. And since this is the Othor Cain show, I feel like I can be totally honest. Can I be
totally honest, brother?
Blunt,
totally honest. Totally.
All right. As a nation, we were not as prepared for this as we should have been. Okay? And I'm not here to politicize this. This is not about Democrat versus Republican. It's not about young versus old, low class versus high class. Right now, this is about morality, ethics, and just humanity.
Right.
Okay?
Right.
All that being said, if we got wind that the first case of this was back in December, and we know that we have travel between China and the United States, to say that we're going to ban travel is one thing. But at the same time, this is not checkers, this is chess.
Mm-hmm.
And you got to be 3 steps ahead. If you play golf, you don't just plan for the next hole. You got to plan several steps ahead. Just a couple of years ago, we had Ebola.
Right.
We have to learn from things in the past. So if we had Ebola, what did we learn from it? What we learned, even then, we were not as prepared as we needed to be. So what that particular administration did was created a pandemic office that worked to try to be prepared for things like this.
Right.
So guess what?
It was
office doesn't exist anymore.
It was disbanded. Right. Right.
It was disbanded.
Right.
Right. So that's the first thing. Secondly, you can't have tests if you don't make enough tests. And you can't make enough tests if the people that are making tests don't have the support that they need for quote-unquote mass production. Not just for tests, but also for protective equipment and different things like that. Those things cost what? It costs money to do those things. But we have to make sure that we supply the particular people that's supposed to make it with the resources to be able to do it.
Mm-hmm.
But this is April, man. This is April, and we still talking about not having enough tests. Like,
right.
That just baffles me. Like, we have, I think Tupac had a song, we got money for wars, but we can't feed the poor. Like, what are our priorities as a nation if we don't make sure that we're doing what's needed? So when you look at South Korea, Singapore, they were able to minimize the avalanche because they tested more people. Now, because we don't have enough tests, we had to prioritize who were being tested. So the people who were being tested were the people who have a fever of 100.4 or higher, the people who are healthcare workers, because they're on the front line. If you lose a healthcare worker, especially in Mississippi, where we have the lowest percentage of doctors to patients. So I'm not sure if the people listening know that. We have the lowest percentage in Mississippi per patient in the whole nation. So, for example, I got 3,000 patients. If I die, something happens to me, and hopefully I don't. But if I do, then there's 3,000 patients. They got to find somebody else to take care of it. Right. So all that being said, healthcare workers have priority too, because you don't want to be going to the doctor and your doctor got it and give it to you, or the nurse or the respiratory therapist. So that's another important priority of healthcare workers. Thirdly, the people who are immunocompromised. As I talked about at the beginning of the talk, people who are immunocompromised, they're more than likely to die from this thing. 80% of the people who have this would do just fine. You interviewed someone yesterday who did just fine. I got 3 patients who've been diagnosed with this, and all of them are still alive, and all of them are doing just fine.
Right.
But there's 20% of the people who are going to have some complications, and less than 5% of people will die, unfortunately. So we're prioritizing the test toward those. Now, I happen to be on the task force with the city of Jackson.
Right.
So I just got off the phone as we had a meeting at 3:00, and I think the mayor's already did a press conference where we have agreed to invest in several thousand tests.
5,000 to be exact.
Yeah. 5,000 with, and 1,000, correct me if I'm wrong, 1,000 that's going to definitely be prioritized to first responders, because just first responders who are being affected, and they're on the front line too.
Absolutely. First responders and inmates in Hinds County Detention Center. Yes.
Yeah. Thanks for correcting me on that. So, and we just had to make a decision. Do we wait on getting tests from the nation or whoever's supposed to be dropping these tests, or do we make a decision to go ahead and do so? So I applaud the mayor,
right?
Because we agreed to tap into some funds to make sure we take care of our people. So those tests should be here hopefully no later than Friday, and we're collaborating with Jackson Hinds to be able to do those. And this particular test, Mr. Cain, allows us to get results within 90 minutes.
Oh, wow.
90 minutes.
Wow.
So your original question is, do we have enough tests? No, but we're working on it. Here's another barrier. Right now, New York is a hotbed of cases. Mm-hmm. Louisiana cases are rising. And there's a company called Abbott that is pumping more tests out there. They're getting support, right?
Okay.
But they have to kind of prioritize the places in the nation where there's higher incidence, there's higher new cases, there's higher mortality compared to other states. So we're reaching out to them, but they're shifting most of their resources to New York and other places where there are more cases.
As you were speaking, Doc, you reminded me of an article that I read about small town Holly Springs, Mississippi. Okay. And some nurses and doctors that are on the front line, but they are scared because it's so rural and their connection and ability to get stuff is even more scarce than ours in Jackson and in Hinds County. And this nurse talked about PPEs. Yeah. And how she's afraid to go home and all this stuff is being discarded now. Talk a little bit about, because when you talk about flatten the curve, that's one of the things that we don't want to overtax our hospitals and all of that. Talk a little bit about PPEs and flattening the curve.
Okay, so for someone that's listening that may not know what that is, we're talking about personal protective equipment. And this is a combination of gloves. It could be a mask. It could be gowns. It could be face shields. Personal protective equipment is vital to what we're doing. It's kind of like going to war without having a gun, going to war with a knife. All right. So your healthcare workers right now are on the front line, and we're dealing with things. So, for example, you got respiratory therapists that go in and do breathing treatments. They are probably at highest risk right now because when they're doing breathing treatments, there's a lot of stuff that could be expelled in the air. So they need to have on everything: a face shield, a very, very high filtered mask, such as an N95 or N100, gloves, gown, and all of that. So we have to have that equipment in order to be able to provide care to protect not just the patient, but protect the actual worker. So I'm also on a task force with our state medical association called the Mississippi State Medical Association, led by our chairman of the board, Dr. Jennifer Bryan, and she's been a big advocate with really thinking about not just the big man, but the little man. And we're basically trying to engage doctors across the whole state. We've got about 6,000 in these small areas to provide resources. So telehealth is a way that we're able to coordinate some of that. You asked about ventilators. So,
I know, right. I was going to go back to that because I realized you did that.
As far as ventilators, you got places in these small towns that don't have all of the access. So right now, pre-COVID, there's places in the Delta and stuff that are struggling. And what happens is when they have cases of someone may go to the ER and they think they may have a stroke, it may take 3 hours to get from, the Delta down to Jackson. But what they do is through telehealth, and they work with UMC, and they're able to talk to a doctor there that's a regular doctor and connect them with a neurologist at UMC, and they're able to make a decision whether or not they need to get the clot buster. Because if you get the clot buster, if you have stroke-like symptoms, a lot of times all your symptoms can be reversed, and you're not left with the long-term complication of not being able to move your right side. So the same way we have that type of setup pre-COVID, we have it now during COVID. There's ventilators that we use that are called traditional ventilators, but there's also different machines that we can use that work like ventilators, okay? So you may have heard that some of the experts have not said how many ventilators we got. Or they may have not said how many hospital beds we have.
They've been tiptoeing around that. I've noticed that.
Yeah, but we have to be careful with answering that because we're working really, really hard behind the scenes. Like my task force with the state, we meet 3 times a week, and our meetings last from an hour to 2. So you got the collaboration between the State Medical Association, which is all the doctors. You have the Hospital Association, which is all of the hospitals in the state, and we're preparing for the surge. We're preparing for the peak. So if anybody listening have not heard, these next 3 weeks are about to be very, very critical, and we may peak late April, maybe early May. And when we peak, it can be really, really bad. So some sources are suggesting that we can have anywhere from maybe 800 to 1,400 deaths. And right now, we're not even near close to that. So, unfortunately, there's still some people that's not taking it that serious, and they hear that.
Right. But let me ask you this, and I hate to interrupt your thought, but let me ask you this. What makes this the peak season? Why are we bracing ourselves for the next 3 or 4 weeks? Explain that to us.
So data, research, and, so one thing that we talk about on these task force meetings is what is California doing? What are these other states doing? What is South Korea doing? So these places where we have issued things like the shelter at home or lockdown and different things like that, and we've been able to get the public to be compliant with staying at home and not spreading. So let's theoretically say that everyone does what they're expected to do. All right, Texas is limiting travel from Louisiana. If everyone stays at home and does what it's expected to do, it doesn't necessarily reduce the overall amount of cases, but it does spread out how fast the cases develop and how fast they spread. And it also allows the healthcare workers to have more time and more resources to be able to handle this. Because although we're talking about COVID, there's still people who are coming in with strokes. There's still people who have heart attacks. There's still people who have cancer and stuff like that.
Right.
So what we don't want to do is overwhelm the medical system.
Gotcha.
Okay, because if we start doing that, we're going to get in trouble. So flattening the curve has to do with spreading out everything over a longer period of time, so we can't have enough beds. So right now, I can tell you right now, we have enough beds right now. We got enough ventilators right now. But if you look at the curves and you look at the data, you look at how many new cases and stuff that we're having, and you also look at the prevalence, which has to do with the amount of cases at one particular time, and incidence has to do with the amount of new cases. And this is all epidemiology, that class that, we took, and yeah. So if you look at the data and you look at the curve, and if everyone does what they're supposed to do, and I saw some people in Presidential Hills not doing something better than
right.
If everyone does what they're supposed to do, we can go ahead and prepare for the curve to start flattening. The problem is everyone's not doing what they're supposed to do.
Right.
So it's gonna make that possible peak, that surge, lag longer and longer and longer. But if we do our part, like I said, if you look at South Korea, you look at China. China's opening back up for business. This is temporary.
Right.
This is temporary, but if we can get everyone to buy in and do what we're asking people to do, we can get through this faster. We can watch football, for God's sake.
Right.
We're not taking it serious.
No, we're not. And I think one of the reasons some of us are not taking it serious, Doc, is you hear about the disadvantaged populations, seniors and all these folk who have a greater risk. I think that young people are not taking it as serious because of the information that they've been fed. They seemingly think that they are immune to this. And I don't think that they are immune to it just because they're young.
Okay, let's talk about that. So if you're breathing and you have lungs, this thing can get inside your body. So let's talk about that first. So, and the more mucus that's built up, the harder it is for this thing to be fought. Mm-hmm. So this disease affects inflammation and mucus. So if you're breathing and you have lungs, you can be impacted. So in Mississippi,
no matter what your age is, right?
Yeah, I mean, look, there's a 12-year-old that's on the ventilator right now.
Right.
And there's people at the children's hospital who are struggling. So if you're listening, anybody who is breathing can get this. I got to make that clear. Secondly, please remember that you don't have to have symptoms to have this.
Right.
You do not have to have symptoms to have this.
Right.
So if you've been asked to stay at home, because although you may be 20 and you may not have any symptoms, you can have this from going to the grocery store But if you go and visit your grandma at the nursing home, you can take it there. And now everybody in the nursing home get this, like, this thing can spread really, really quick. So if you listen, yes, you can get it. Second, let me point this out. We don't go to the doctor, Othor.
Right.
We don't go to the doctor until...
On a normal, on a regular day, we don't go.
There's so many folks on my timeline that's arguing with me talking about they don't go to the doctor because they don't get sick. I have diagnosed more young people with heart disease, diabetes, and when I say young people, I'm talking about 20s. I'm talking about folks that then got defibrillators in their 20s.
Wow. I'm
talking about people that are put on heart transplant in their 20s. You don't know it. You don't know if you have something if you don't go to the doctor and get tested.
Right.
We lead the nation in diabetes in Mississippi. We lead the nation in heart disease. So stop saying that you're fine because you think that just because you feel fine, you are fine. The absence of symptoms does not mean the absence of disease. So the minute that you start feeling different, you need to go to the doctor. Or if you have not seen a doctor within a year, you need to schedule a telehealth visit, preferably with Turner Care, Dr. Turner.
Right. That's a good plug. You're more than entitled to that.
If you haven't seen a doctor within a year, you need to do so because you need to make sure that you're not part of that the high risk category. And I want to mention one other thing. So I want to talk about the psychology behind some of this as well. There's a huge distrust in the black community with government. There's a huge distrust in the black community with doctors. There's a huge distrust in the black community with our healthcare system. So we just got to be honest. I got to put it out there. I talked about this at a talk at the Civil Rights Museum. This goes back to the Tuskegee Institute. So, this thing is huge. And I gave a talk at the Civil Rights Museum, and I titled it PTSD, Post-Traumatic Slave Disorder. And it has to do with the fact that our people and our ancestors, this thing was bad, man. I was boiling when I gave a talk about this. I almost broke down at the Civil Rights Museum because it was so powerful. The fact that in the 1940s, we were told that there was going to be a study for 6 months where they was going to look at syphilis. And instead of it lasting 6 months, this thing lasted, I think, almost 40-some years where they gave our black women this particular disease and watched us have secondary and tertiary problems with this thing. And we gave birth to kids who had it. Man, that left a bad taste in a lot of people's mouths.
Right.
So I struggle on a daily with just trying to get my people to come to the doctor because they don't feel as if they can trust. Right. So they watch grandma just take the aloe vera plant, break it open, and put it on that knee and keep it moving and break out that thing. You know what I'm saying?
And drink ginger ale.
Drink ginger ale, yeah. And there's no knock against that, but we would never be able to get through something if we don't address where the underlying fear and disconnect comes from.
And Doc, I gotta tell you, you're so on point. You're so on target. I was having a conversation on Facebook last night with a colleague of mine, and he talked about the government, and he swears this thing is happening because of the government. He swears that. He's younger than I am, but he swears it's happening because of the government.
Yeah.
So that disconnect is there. You brought up a couple of things that I want to touch on and get you to give you an opportunity to unpack. Let's talk about this rumor of 5G. Make the connection for me, please.
Hey, look, I would love to make a connection if there is a connection.
Right. That's what I was trying to tell him last night, man.
Literally, I would love to make a connection if there is a connection. So let me share this. I've reached out to one of my friends of mine that's in the tech world.
Okay.
Right? Okay. And one thing she talked about is basically these are the facts. So $7.3 trillion in value has been wiped from the United States stock market since February of 19, right? So the total telecom industry market is about $40 billion.
Okay.
So if 5G caused COVID-19, all the cell communication towers would have been burned down by now. The increased wireless speeds, benefits, and the potential profit growth for the telecom industry would not be worth the public health or the economic toll on the United States or any other country. So as it relates to 5G, all of this stuff has to be approved by the Federal Communication Commission.
Right.
So they look at the impact of new communication technology and its effect on stakeholders, and public health is something that they have to look at. Mm-hmm. So there's an official place for us to file complaints if there is an actual complaint. But just posting on social media that this thing is not real and 5G is costing it is reckless and it's irresponsible. Now I stand corrected if we find out different information 15, 20 years from now. But my question right now is it worse you not going to the doctor because you believe this is all a conspiracy theory when you see black people, brown people, white people being disproportionately affected?
That's a great point. I mean, you just explained it because there's nothing to back that up with. And if on down the road we find out, then we all owe everybody an apology. I gotta tell you, I'm sorry.
No, I was saying true. I'll be first.
I'll be right behind you. I'll be right behind you.
What you focus your mind on will grow. And I think we have to be strategic with how we are expending our energy right now.
Right.
Like, I really have to take a break from social media because there are people I went to school with. I'm like, what are you talking about?
Man.
What are you spreading?
Man, let me tell you something. I had to tell some people yesterday and today because I'm getting all of these inbox messages, text messages, and all of this kind of stuff. And I finally said, you know what? I have put myself in a position where I am only reading information from news organizations that I trust and that I follow on a regular basis. Stop sending me videos, stop sending me remedies, and all of that kind of stuff. Stop sending me stuff to make these concoctions, to do all of this. Just stop sending all of that stuff to me, right? Because you've got to take a break from consuming all of this stuff. And I've resigned myself to only reading and listening to news organizations, and doctors and people that I actually trust. Having said that, though, Dr. Turner, I gotta tell you that I was a bit, and this is just my own biasness.
Yeah, that's fine.
But I was taken aback at the initial onset of this thing in Mississippi. When I looked at and I love Dr. Dobbs. I think Dr. Thomas Dobbs is a great guy, and I think he's doing a great job leading us through this. But I gotta tell you, I covered several press conferences until I decided that I need to cover it from afar. And so I was out there doing all this stuff, man. And I gotta tell you, I was really a little disappointed because I didn't see an African American on the state level a part of the conversation early on. Now, I know Dr. Brunson, and I know who he is and what he's done, but I was really taken aback that I didn't see an African-American a part of the conversation early on. What are your thoughts there in terms of African-Americans in medicine and leading the conversation? And I don't mean to put you on the spot, and if you can't answer it, I understand. That's just my own personal biases.
So listen. So I told you in the beginning that I took a job in 2011 working for a hospital corporation. I didn't renew that contract in 2013 because I refused to be a puppet in a system that wasn't designed to take care of people that look like me and you.
Got you.
And really, and it wasn't just about blacks. I mean, even what we call lower class, just everyday working people. I can't see 60 patients in a day every 6 minutes and think that I'm providing quality care. I just can't. I couldn't do it.
Right.
I remember I was trying to pray with a patient and they knocked on the door and didn't want to allow me to be in there for an extended period of time because if I saw that amount of patients, that means it brought a certain amount of revenue. And if I brought a certain amount of revenue, then the people at the top was taken care of. And that's the problem now. We got hospital administrations that are asking doctors to take pay cuts right now while the CEOs are at home, while the doctors are down in the front line.
Right.
But as I digress, so in Mississippi, there's about 6,000 doctors. And I think right now there's no more than 300 that look like me and you, Othor.
Wow.
And yes, you mentioned Dr. Brunson. Dr. Brunson is a past president of our Mississippi State Medical Association.
Right.
And he was the first black president of that organization. And
that's been very recent, right?
I was shocked that he was chosen. So just for everybody that's listening, before the Mississippi State Medical Association existed, I mean, there was also another organization called the Mississippi Medical Surgical Association. So Dr. Robert Smith, the late Dr. Aaron Shirley, a lot of black doctors established this organization because they were not allowed to go into the hospital to deliver babies. They used to go to Jackson State and Tougaloo to deliver babies and provide adequate health care that they weren't able to get in the past.
Right.
So all that being said, the State Medical Association is all doctors, but the Mississippi Medical Surgical Association is just all the black doctors to make sure that we have support.
Right.
All that being said, we've made a lot of progress since then. Dr. Brunson being elected is a big deal. Dr. Brunson is still serving on many task forces. He's widely respected. I appreciate the efforts that our State Medical Association has made. At the same time, we have a whole lot more work to go on the state level. Now, on the local level, Dr. Vernon Reeves, Dr. Timothy Quinn, and myself all serve on the city's task force. But we have a whole lot more work to do as a state. I mean, we're still talking about a state that celebrates Confederate month.
Yeah, that our governor just recently signed, as quiet as it's kept in the middle of all of this.
Right. So, like I said, I'm not here to politicize.
Right.
But we have to call a spade a spade.
Right.
We're not where we need to be. We're making progress, but we're not where we need to be.
Very good. Very good. Doc, I want to begin to wrap this up because I know you got 1,000 things to do, but I want you to talk a little bit as we close, a little bit about the importance of social distancing and really taking this thing serious.
Okay. So, listen up, y'all. We talked about this thing possibly peaking in the next 3 to 4 weeks. All right. It can peak, the curve can come down, and we can return to life with our new norm. We won't ever go back to the same. I heard your talk yesterday.
Right.
Things would never be the same. Listen up, y'all. Things would never be the same. This is going to be the biggest historical event in most of our lifetime, especially for doctors, okay?
Right.
We're going to be able to save a lot of people, but unfortunately, a lot of people are going to die. And I'm a God-fearing, miracle-believing doctor, but all you have to do is look at your timeline, and you're seeing more and more people post RIPs. We can minimize that, y'all. We can minimize that by practicing social distancing. Now, we've got the mayor to agree to doing a shelter in place. We've got the governor to agree to doing that. But social distancing does not mean have a barbecue at home and have 20 people over.
Right. Because it only takes one, man. It only takes one.
It takes one. So one person can affect 3.
Right.
3 can affect 9.
Right.
9 can affect 27. 27, 81. 81, 247. Do the math.
Right.
But literally one person can affect 1 million people in 6 months.
Right.
Let me say it again. One person can affect 1 million people in 6 months. So with that being said, people, don't let this have to hit home for you.
Right.
To realize how serious this is. Stay at home. Take advantage of this time. And you talked about Othor. Be creative with your time. Like, we've been able to do more cleaning up at the house than we've done in years.
Right.
My wife has cooked more. And it's no doubt on her. I love my wife, but she's cooked more this month than she's done since we've been married. And that's okay. I don't put pressure on her to cook. But she's cooking new stuff that she's never cooked before. She's excited. It's doing good for her mental health, for our mental health.
Yeah.
Like there's some people that's married that you realize that, man, they've been tolerating each other for a long time. They've been practicing more toleration than they have appreciation.
Right.
So we're seeing domestic abuse go up, and we're seeing all types of stuff. But this is a good time to work on maybe a budget that you don't have. This is a good time to maybe think about that invention that God has given you, but you just had to slow down to do it. It's a good time to write a book.
Right.
This is a good time to come up with new dreams. This is the time to work on having multiple sources of income. Like, you heard that you need to have 6 months worth of savings saved up, but now you realize that, what they said is real.
That's like for real. Yeah.
So how can you start to invest in real estate? How can you take advantage of the stock market? Like, take advantage of this time. Like, everything happens for a reason. Nothing happens by accident.
Right.
You don't control everything that happens to you, but you do control how you respond.
That's exactly right.
Social distancing means stay at home as much as you can. If you got to get out and go to the grocery store, go so. But all 4 of y'all don't need to go.
Right.
Make a list. Be organized. If you can do pick up, cool. But if not, be organized. Go in there, get what you got to get, and leave.
Right. Right.
Don't be breathing all up behind somebody's neck that's next to you. Like you can talk and you can spread this thing.
That's right. That's right. And that's a great point, because now the Mississippi State Department of Health, they're saying everybody needs to wear a mask if they're out, right? Not just the hospital workers, not just those folk on the front line, but everybody should be wearing a mask now.
Everybody should wear a mask. And let me say this: there's a lot of mask bashing on social media. There's a lot of people that are bashing people, saying, well, why wearing a cloth mask? It ain't gonna protect you. Like, you don't need to wear that, because you don't have the real thing, or people not wearing it the right way. So I'm not here to judge anybody. Listen, wearing a mask is important for a couple of reasons. First of all, wearing a mask helps minimize you from spreading anything that you may have. It could be COVID-19, it could be the flu, but it minimizes you spreading droplets out there in the atmosphere. Okay? Now, a mask doesn't 100% protect you from getting COVID-19, but it minimizes how much it's penetrating, and it also minimizes how often you take your hand and pick your mouth and your nose. A lot of people don't realize how often they pick their mouth and their nose. And this thing's enter your body through your mucous membranes.
Right.
All right. So
and I got to tell you, I've never had such an urge and seemingly need to scratch my nose, to poke my eyes until now. It's like the urge is there.
Exactly. So there's a lot of ways to be able to make your own mask if you don't have them. And Sam Jackson's posted some on their site. So everyone needs to wear a mask. Secondly, let's talk about gloves. A lot of people have on gloves and they're not changing their gloves.
Right.
When they come to see me and my staff give you a shot for Rosefin, they're going to take that glove off before they go into the next room. That minimizes cross-contamination.
Right.
If you have your glove on and you wear it and you go and pump the gas, you keep your glove on and you go to the grocery store, you touch the boogie, you leave the buggy and you grab all your items. If you keep your gloves on the whole time, you're spreading the germs across the whole city.
Right.
So if you're going to wear gloves, be prepared to take them off and change them.
Discard them immediately, man.
Yeah. Not in the parking lot like I've seen.
Right.
Let's
Trash
container.
Right.
Let's have some sense of pride about ourselves. People, somebody got to pick that up.
Right.
So that's gloves. I was going to mention something else. So we talked about masks, talked about gloves. Can I just give some helpful tips for everybody?
Please.
Just some basic stuff.
Please.
All right. So at Turner Care, we focus on being proactive and not reactive. So, like I said, I got 3 patients who got this and they're all doing well. That don't mean that all my patients are going to do well, but literally most of the patients are doing better compared to others. So the best way for you to beat this is to keep your immune system healthy as possible. And the way that you do that is by getting more fruits and vegetables, minimizing red meat. So minimize pork, minimize beef. Those things are very toxic in your gut. So I told y'all before that 7% of your immune system in your gut. If you listen to this right now, you belong to one of 2 categories. Either you eat to live, or you live to eat.
Yeah.
And what we have to do is juxtapose that thing and focus on making sure that we eat properly, because if your immune system is healthy, you have a better chance at being able to fight this. So minimizing the red meat, minimizing dairy. All right, we are the only species that actually drink milk from another mammal. So instead of trying to drink milk that belongs to another mammal, how about getting almond milk, which is what my family drinks? How about getting soy milk?
Right.
Dairy causes a lot of inflammation in the body. That can cause a lot of mucus buildup. The more mucus buildup you have in your body, the harder it is for you to fight this thing.
Right.
All right? Get adequate sleep. You need to get at least 6 hours of sleep. When you're sleeping, your body is totally resetting everything. If you get adequate sleep, you have a better chance. There's a lot of people listening to this who are not getting adequate sleep because they got sleep apnea, but they don't know that because they ain't been to the doctor in a couple of years. Once again, go to the doctor, okay? All right, so in addition to adequate sleep, keep your stress level down.
Right.
Stress weakens the immune system. I had a patient this morning who was like, Dr. Turner, thank you so much for getting me a therapy appointment. Like, I was asking you for sleep medicine, I was asking for depression pills, I was asking for Xanax, and I had no idea that all of this was stress, Doc. Doc, I'm mad at you because you should have made me go to see that therapist way sooner. But at the end of the day, I can't make anybody do it. But guess what? There's telehealth services available for anybody who's dealing with stress management. These are tough times right now. We don't know what's going on financially.
Right.
I had a patient today with Nissan who was laid off. I mean, people don't know what's going on.
Right.
But you are not designed to fight this thing on your own. There's people out there that can help you. So utilize telehealth services and get therapy if you need to get therapy.
Absolutely.
Do some yoga. Like I'm gonna try to get something set up to where we can kind of teach some virtual yoga. And if anybody's interested, make sure you follow the pages. So we're gonna work on doing some yoga exercises. Like I did yoga for the first time, and it was amazing. Like, don't judge me, but I really thought yoga was something that just white people just did. I ain't gonna lie to you.
Well, let me tell you something. My friend Dorian, she swears by yoga, and she does it every single day. She swears by it.
Yeah, I didn't think it was something that men do, but like I literally leave yoga with like the weight of the world feel like it's lifting off me.
Yeah.
So yoga helps with stress management and stuff like that. So listen, there's some natural things that we don't have conclusive evidence as far as if they work. But here's what I tell my patients: if there's no significant harm or if there's no significant risk, then the benefits outweigh the risk. So get elderberry. Get vitamin C, at least 100 milligrams. Get vitamin D. Get your zinc, at least 25 milligrams. There's some promising research suggesting that zinc helps with this. So get zinc at least 25 milligrams a day. And did I leave anything else off? Echinacea. So those are the 5 things on my toolbox.
Doc, that's good stuff, man. This is absolutely amazing stuff. In fact, at the end of this interview, I'm headed to Cindy Harris Elliott to pick up my vegetables, man. I ordered a pack from her, and I'm going to get it chucked into my truck when I leave this interview. So, man, listen, brother, thank you so much. Thank you so much. I think that what we needed in this area, I think what we needed was you. I think we needed a real person to break it down and to help us to understand where we are. So, brother, I thank God for you. I thank God for what you are doing, and I thank you for being on the front lines.
Thank you so much. Well, look, I appreciate you because you're out there doing real media that's relevant. Leadership matters.
Absolutely.
All that does. I'm leaving here headed to Select Special Rehab. I got a 7 p.m. to 7 a.m. shift. So the only thing I ask is that you all pray for me, pray my strength.
Absolutely.
Because, nobody can do this alone. So thank you, Othor. Thank you all for tuning in. And let's stay engaged and let's beat this thing.
Absolutely. Tell your wife I said hello. Thank you for joining us, man.
Yeah, we'll do, man. Take care. And if you need anything else, man, please let me know, okay?
All right, brother. Thank you.
All right, peace.
All right. So that was Dr. Justin Turner. Great information, right? Listen, great information. I can't thank him enough for joining our red wine conversation this afternoon. I think finally we've got some information that we can grab a hold to, right? We've got some information that we can grab a hold to, and Dr. Turner laid it out beautifully. So I would invite you to share this live stream with your family, with your friends. It's about saving lives and doing what we can to flatten the curve. Thank you for joining us. Thank you for tuning in. Stay engaged, stay healthy, and stay at home.